British Prime Minister Boris Johnson was infected with the COVID-19 coronavirus in early April 2020. This disease caused Boris to be hospitalized for entering a critical state for several days and finally recovered Monday, 13 April 2020. The situation forced him to devise a strategy for the British executive government if he really lost the leader. Quoted by mind-racket.com from Sky News, Boris revealed the plan when interviewed by one of the British media. Before describing his strategy, he was really worried because liters of oxygen were given to Boris since entering ICU on Tuesday, 7 April 2020. It was a very difficult moment, I could not ignore it, Boris said. They agreed to take strategies such as the Stalin's death scenario, he continued. I am not in a brilliant condition to plan, and I understand that contingency reserve plans are needed. Doctors have all kinds of things that are needed if the condition gets worse. They gave me a face mask, so I got liters of oxygen, and for a long time I had it for this small nose, added Boris. When Corona tested positive at the end of March 2020, Boris tended to ignore the SARS-CoV-2 virus infection. I said I didn't really want to go to the hospital. Apparently, that step was not right for me, but they insisted, Boris explained. Behind me, they really forced me to leave, Boris continued. After the condition worsened and he was taken to the hospital. He claimed to be so frustrated with the situation. I am increasingly frustrated because indicators always point in the wrong direction, and I think, there is no cure for this disease and no cure. At that stage one began to think, how can I get out of this COVID-19? Boris said. However, luckily he recovered and was able to announce the results of an evaluation of the lockdown on Thursday, May 7, 2020. He suspected there would be a second wave of outbreaks of the coronavirus pandemic in the UK. Recently, the British PM followed the Scottish government's policy that required the use of face masks in public spaces. Boris said that social distancing is very useful to be applied for the sense of security of the community when returning to work. This remark came out 2 days after the British Secretary of Health Matt Hancock stated that the use of masks in public spaces was only supported by weak scholarship.